Good afternoon. We're going to go ahead and get started. I want to keep on schedule because our named, or the professorship for whom this is named is a long-winded individual, and we will try to replicate that, or I'll try to replicate that in my remarks. So thank you for joining us. I'm Stan Gerson, Dean of the School of Medicine, for the appointment of Dr. Adam Bergener to the Adel A. Mahmoud Professorship in Global Health and Vaccines, and a special welcome to Megan and daughter Hannah, who are with us this evening. So I'll just remind those of you who don't think enough about this that endowed professorships at universities is a fairly ancient tradition going back to 1540, and King Henry VIII, who may have been known for a variety of things, but he established the Regis Chair in Civil Law at Oxford University. The oldest in the United States is the Hollis Professorship of Mathematics and Natural Philosophy in 1721 at Harvard. Part of the Divinity School, now part of the Department of Physics, just shows you how these things can change. And it is currently held by a woman, Karen King, although I'm not sure that Dr. Hollis imagined that that would happen. The oldest chair at the School of Medicine is the Leonard C. Hanna Professorship, established in 1901 from the family of Howard Hanna, honoring his father. Next came the Henry Wilson Payne Professorship in Anatomy, 1903, that's now held by Agatha Exner in Biomedical Engineering and Radiology. Then the Hannah Payne Professorship in Experimental Medicine from both the Howard Hanna and Oliver Payne families. They were related. That's now held by Nate Berger, who wishes he could be here, but his health denies him the ability to be on site, but he may very well be listening in. So we now have more than 130 endowed professorships in the School of Medicine, brought forward through family, friends, and alumni of our university. And they help keep to our mission, which is pertinent in this instance because the school's mission is to improve global health by linking research to populations in a superb educational environment. It helps, is the glue, I think, that connects our more than 3,600 full-time faculty. So a little bit about why global health is so important this afternoon, and that is the pioneering work of Adel Mahmoud in infectious disease vaccine development and global health. Adel was born August 24th, 1941 in Cairo, the eldest of three. His father was an agricultural engineer, and his brother was a medical student who had to stop working because, his brother, who was a medical student, made sure that his sister did not, in fact, attend medical school because she was a woman. In addition, Adel had a experienced contracting pneumonia and couldn't find penicillin, and his father actually died of that familial disease in the family. Adel then went on to study medicine at the University of Cairo, graduating in 1963. Went to Britain in 1968, where he received a doctorate from the London School of Hygiene and Tropical Medicine in 71. Came here in 73 as a postdoctoral fellow in the School of Medicine, then became an assistant professor, worked as only Adel could, up to become the division chief for geographic medicine. Under then chair of medicine, Chuck Carpenter, then inherited Chuck's job in 1987 to 1998. And I have a picture of Adel in a younger period. Some of you will recognize Neil Cherniak to Adel's left. prior dean of the School of Medicine. This was when Adel was chair of medicine and I was division chief, and you can imagine who was doing the talking, which was Adel's style. When I received my endowed chair, the Civic Professor chair, I asked him what comes next, and I often quote at sessions like this, because he said simply, pat in the back, think bigger thoughts. So that's the job of our professors. So Adel cemented the commitment that had emerged under the leadership of Dean Fred Robbins for global health as part of the curriculum and research programs of the School of Medicine. He helped initiate the Ugandan projects ongoing to this day, and now led by a number of those in the room, including Bob Salata, Henry Boom, John Karn. Initially looking at TB and malaria, now HIV, and we've just started with UH, a sickle cell stem cell transplant program. He built an incredible group here, met Sally Hodder, who graduated from the School of Medicine in 1980, and an infectious disease expert, and they married in 1993. Sally's not able to be with us today because she is delivering a eulogy at a friend's memorial service, but certainly she wished she could be here and has been in the past. And she has had an incredibly successful career in her own right as the director for the Center for Translational Research and vice dean at the University of West Virginia Medical Center. Merck recruited Adel from UH and Case in 1998, and he was vaccine development president at Merck from 1998 to 2006. He oversaw the creation and the marketing of several vaccines, one for rotavirus, another for HPV. He helped Merck get that vaccine off the ground, and he helped usher in a number of vaccine efforts at Merck: measles, mumps, rubella, chickenpox, shingles, and his efforts came to the attention of Julie Gerberding, one of our graduates from 1981, who is now chair of our board of directors at Case, and has one of our 6 School of Medicine medical student societies named in her honor. And at Merck, she was serving as the executive vice president and head of the vaccine program overseeing Adel's effort. She had been the director of the CDC program for prevention and control, and is currently, having just left Merck, is the CEO of the foundation for the NIH. Although she joined Merck just after Adel had retired, she certainly knew him in the infectious disease world as a lifelong mentor, and has championed many of his efforts years after he pursued the initial efforts, and has helped us with Merck's support for this endowed chair. And since Dr. Bergner works in cervical cancer and HPV, I should note the special effort that Adel made in pursuing the HPV vaccine, and had to overcome the anxiety that it was really a sexually transmitted vaccine vector, and that it should only be given to girls who became sexually active, and that actually decreased the utility of the vaccine's introduction, and he was very adamant that it be converted to a infectious disease vaccine. He was a good friend of Tony Fauci at the National Institute of Allergy and Infectious Diseases, and according to Tony, Adel's efforts were incredible to help move the field to accepting this vaccine. And Doug Lowy, who actually developed the vectorology for the vaccine, was grateful for Adel's work as well. He later was involved in the Ebola outbreak in West Africa in 2014, and helped the world develop its vaccine efforts, and that's still ongoing. Back at the School of Medicine, he has served as the chair of the Dean's Visiting Committee for many years, and he died suddenly, and we were grateful that Julie Gerberding, friends, and the Merck Foundation were able to help us establish this professorship in 2017. I saw Jim Kazura come in, who was the first chairholder for this, and I'm delighted that we were able to recruit Adam Bergner to succeed Jim, both as director of our global health program and for our to receive this professorship. Now, I would love it if Julie would have been able to be here with us this afternoon. She also had a conflict on our schedule, and so we asked her to create a short video, which she has done.
Congratulations, Professor. I'm so pleased to participate in your investiture ceremony and to congratulate you personally on your achievements that led to this distinction. I had the honor of being a student of Dr. Mahmoud's when I was at Case Western Reserve, and really a lifelong mentee. He followed my entire career. I remember as CDC director when he showed up unexpectedly one evening in Atlanta to take me to dinner and give me some very important advice about the vaccine agenda at the agency. I followed in his footsteps as the president of Merck Vaccines, and it was basically impossible to fill his shoes. He's the only person in the history of vaccinology who has ever launched 4 globally relevant vaccines in a single year. He surprised everyone within the company. No one believed that he could really do it. And I think some people were not convinced that these vaccines really were going to be globally important. But fast forward today and see where we are with HPV-related cancer prevention. That wouldn't have happened without Adel's energy and his foresight to recognize, even before the launch of Gardasil 4, that extending the spectrum of Gardasil was going to be an important contribution to the long-term value of this cancer prevention. So it's wonderful to see your work unfold and to learn about your interest in vaccines, immunology, and the basic sciences of infectious diseases. I'm sure if Adel were able to participate in today's events, he would be so proud, he would be smiling, and then he would be goading you on to do more and do it faster. So good luck to you and congratulations.
Thank you, Dr. Gerberding, and just remember that she is a strong friend of the School of Medicine and of the university. So I hate to say it, Adam, but you've got big shoes to fill and a lot of advocates behind you, which I'm delighted by, including Michael Edelman, who just walked in. But to tell you more about Adam, I need to turn over to Cliff Harding. Dr. Harding is the Joseph K. Kahn Professor and Chair of Pathology, University Hospital's Distinguished Physician, recipient of the Case Medal for Excellence in Health Sciences Innovation, the highest honor bestowed by the School of Medicine. So to tell you more about Adam, Cliff.
Thanks, Dan. Thanks very much. It's really a great pleasure for me to introduce Adam Bergner as the Adel Mahmoud Professor in Global Health and Vaccines. So, how about that weather out there, huh? It's April in Cleveland. Take note of those of you from Canada. And it's such a wonderful spring day, beautiful spring day with the sun shining that I thought this is appropriate because the sun is always shining on Adam. But more importantly, the light is always shining from Adam onto his colleagues, his mentees, and the programs that he advances. And I'll say more about that in a moment. So Adam is a product of Winnipeg, Manitoba. At the University of Manitoba, he received his bachelor's with honors, his PhD in microbiology and biotechnology. He did 2 postdoctoral fellowships there in medical microbiology and in proteomics and HIV immunity, and he joined the faculty of University of Manitoba and rose through the ranks there. His impact went way beyond Winnipeg. He became an internationally recognized scientific leader in multiple areas, including the microbiome and HIV infection, understanding host factors that determine susceptibility to HIV infection, and the development of mass spectroscopy to study mucosal immunity and the microbiome at mucosal sites, particularly in the female genital tract. So Adam applies strong basic science to clinical investigation with human subjects. His studies have included clinical cohorts, for example, in his HIV studies in the US, Canada, and Africa. His collaborations span worldwide, and this is really all befitting of a leader of a program in global health. His research has led to important findings with implications for HIV transmission, susceptibility, and prophylaxis, women's health, and the microbiome's impact on human health in the context of cancer as well as infectious diseases. So now I'll turn to my personal experience in getting to know Adam, which has been tremendously rewarding. So first, I think it was a great accomplishment for our institution to recruit him here in 2020, right at the peak of the COVID pandemic. And he and his family had to move here during the midst of that time, which was a challenge. Real pleasure to get to know him and his wife, Megan, and their daughter, Hannah, who are up here in the front. And beyond the science, Adam is a great leader with vision, coupled with sincerity and empathy. We recruited him here as professor of pathology and director of the Center for Global Health and Diseases. The original mandate was to recruit Adam, and he was to recruit 2 other faculty for Center for Global Health and Diseases. Since he arrived, Adam has recruited 4 new externally recruited faculty to the center, which is so far double our expectation, and I imagine he'll do more. And by the way, they are here, Christina Farr, Gina Lewin, and Doug Brubaker, and I'm not sure if Stephanie Langle was able to. Oh, there's Stephanie. Okay, so they're all 4 here. Nice to see you all. So in addition to building the primary faculty in the center, he's reached out to engage faculty in other departments, the Cancer Center, and other programs to build collaborations with infectious diseases, the CFAR, and build programs like our Global Health ID seminar series, which is a collaborative and very vibrant forum. So Adam's a great recruiter, but more important, he's a great mentor. I have seen how he generously develops the junior faculty in the center. And so this gets me back to my starting point. The light shines from Adam onto his colleagues, his mentees, and the programs he advances. So Adam, congratulations and thank you for what you bring to our academic community.
Hi, everyone. I would thank you for those kind words from Dr. Gerson and Dr. Harding and Dr. Gerberding. That was really fantastic. And it's a great honor to receive this professorship and stand acknowledged a lot of the history behind this professorship and Dr. Mahmoud. And this is certainly these are large shoes to fill. But I am truly honored to follow in the footsteps of these exceptional leaders. So I was asked to talk about how I got here and my research trajectory. So I really wanted to talk about my early days and what led me to this point. So as Cliff mentioned, I did my training in Winnipeg, Manitoba, which is an icy snowball up in Canada, where I did my PhD in microbiology. And this is a very lab-based research project in biotechnology. I did my postdoctoral fellowships in National Microbiology Lab and the J.C. Wilt Infectious Disease Laboratory, also in Winnipeg, Canada. This is a level 4 facility. They do a lot of research in Ebola, as well as other pathogens, HIV and influenza. But my career really didn't take off until I met this man, Dr. Frank Plummer, and how important mentorship is. And he really changed my life. After my PhD, I was looking to industry to move into biotechnology, and I was underwhelmed by at least the options that were available to me. So I decided to send a email to Dr. Frank Plummer, who was the head of the National Microbiology Lab at the time. He was a director, and he had been on the news media during the first SARS crisis in Canada. So he's a mild celebrity in Canada. He's our Anthony Fauci. And Frank was an intimidating figure, at least publicly. So I sent him an email, and he responded to me the same day, asked me to come in, and I was looking for opportunities. And he asked me to join the lab that week. And that was the best decision I ever made. So Frank, while he was director of the National Microbiology Lab, just some examples of his foresight. He invested a lot in Ebola research in the early 2000s and to develop vaccines for Ebola and these emerging infectious diseases. And the National Microbiology Lab was the first institution to develop a vaccine against Ebola when it came to bear in 2014, during the first outbreak. He invested and he defended these programs very early on when everyone was trying to close him down in terms of these directions. And so he was really a leader. But what he was most known for was his work in HIV. So Frank, during his early years in the 70s and 80s, worked in Kenya, in Nairobi, and where he was studying sexually transmitted infections and, of course, HIV when it came to the forefront, emergence of the pandemic in the early 80s. And this is some pictures of him, including one on the right with him with Stephen Harper, the Prime Minister at the time in Canada, who toured the labs. So Frank was a prominent figure. And when I joined the lab in 2005 for my postdoctoral fellowship, this was the pandemic. This was the situation that we were facing. And HIV was and still is a major global health problem. At the time, there were 2.5 million infections a year. And although we've cut this number in half, it still is a large global health burden. The majority of these new infections are in sub-Saharan Africa, including Kenya and South Africa. And over half of these infections are in sub-Saharan Africa, and over half of those are in women. And women are a major risk group. And so Frank had been doing work in underserved communities in Kenya, which were hotbeds for the pandemic, where there was high HIV prevalence. And he was instrumental at helping set up STI clinics in these areas in Nairobi, and he worked at an STI clinic that provided STI care for those who needed it, and testing, viral testing in areas of very low resource settings. And this is just pictures in Majengo. This is considered a slum district in Nairobi, which is a few kilometers away from the central part of Nairobi. And this is a market that's adjacent to where the clinic sits. And as you can see, people live here very modestly. And this was one of my first trips to Majengo. And it really opened my eyes in terms of how people lived in these environments and how little access to resources that they had. And the clinic that Frank worked at for many years, and in which we did collaborative work when I was a postdoc, was this clinic here, which looks no more than a tiny shed that had a low retaining wall that went around adjacent to the markets. And this is me as a a very, very, very green postdoc talking to a nurse at the clinic, pretending to know what I was doing, and it was a huge learning experience to be exposed to this huge public health need and for people attending these clinics. And Frank had been studying a sex worker population where most of which were at high risk for acquiring HIV. And he had been following these sex workers for 20 years, and sex workers would come to this clinic to get free testing and health services, and there was a little waiting room inside. And this was really instrumental at helping to lower the disease burden in these areas. And this was built through the institutional partnership, and this led to very similar to what's built here at CASE in Uganda. There was a institutional partnership between the University of Manitoba and Nairobi, and Frank helped institute this. And so I was able to do a postdoctoral fellowship under this umbrella with many Kenyan colleagues, PhD students, postdocs, including Winnie and Songok here in this picture. It was a fantastic learning environment. And it really changed my life in terms of what real global health problems were. And just a little bit about the science. Frank had been studying this group of sex workers in Kenya for many years, and they tried to model the risk of infection based on how long a woman was engaged in sex work. And so the model would predict if the longer you were engaged in sex work, the increased probability you were to become HIV infected in an area of high HIV prevalence. Except what they observed was the opposite. The longer a woman was engaged in sex work, the less likely she was to become infected by HIV. And this can only happen if there was a subpopulation or a biological basis for this affecting this model. And they identified a subgroup of women that were persistently seronegative or HIV resistant to the virus. And my postdoctoral work was discovered several things, including they had differences in mucosal immunity, but also they had a quiescent immune system, which provided some protection from HIV infection. And this kind of led to I was asked to talk about my research program, and this is how I tackle my research program, in that with any infection, all those who get exposed to a virus don't necessarily become infected, and those who become infected don't necessarily develop disease. And so there's a couple of trajectories that we can go, those who have protection and those who are more susceptible. So we study human populations at this intersection to use this information to understand what are correlates of protection against an infection and what are the correlates of susceptibility to help inform vaccine design or risk factors for infectious disease. And one of the pivotal findings came in when I started my lab. Excuse me. And we were studying HIV transmission in South African women and mucosal immunity to infection. And at the time, and there still is no vaccine against HIV, and at the time, pre-exposure prophylaxis was being explored as a method to reduce risk of acquiring HIV in HIV uninfected individuals. And pre-exposure prophylaxis is where an HIV uninfected person takes a drug that's used to treat HIV infection prior to having sex in order to protect themselves from infection. And this comes in many different forms, including oral pills, vaginal gels, vaginal films, and vaginal rings, as well as long-acting injectables. But at the time, this is early 2010s, the landscape for these different prevention trials, these different prevention modalities had really mixed success in women. They were highly successful in men, but in women, they were not as successful, and this is largely due to adherence. Adherence needed to be very, very high in women compared to men. And it wasn't really understood why adherence needed to be so much higher for women than men. And the range of the efficacy is shown on this graph. But it was really highly variable. So we're interested in looking at biological factors that could affect how these drugs may be working. And at the time, the microbiome field was really exploding. And the microbiome is, and to the audience that's not aware, it comprises all the bacterial, fungi, and viruses that live within our body. And the microbiome does a lot of important things, including helping us digest our food, shape our immune systems, and also determines whether mosquitoes will like to bite you or not, and also whether certain drugs will be toxic to your system. So it plays many important roles. And this field was exploding and being linked to a lot of different diseases. And we were interested in the microbiome of the first site of contact for HIV, which was that of the vaginal microbiome. So we did a sub-study of women in South Africa that participated in the Capriza 004 trial. And in this trial, women were randomized to 2 different gels, one containing tenofovir, one as a placebo. And women were taking this gel before and after sex in order to provide protection from HIV. And the overall protection offered by the gel was about 39% in the intent to treat analysis in the parent trial. And this was really a groundbreaking study because it was the first study that showed that PrEP could work. But it was below the threshold that was needed to roll it out on a global scale. And in our analysis, we studied the vaginal microbiomes of the women in this trial and found that half of the women had lactobacillus as a dominant bacterium, and the other half did not have lactobacillus, instead had Gardnerella vaginalis and other anaerobic bacteria. And in women with lactobacillus, the drug worked 3 times better. And in fact, in women that had high adherence to the drug, the efficacy of tenofovir was upwards of 78%, which is almost as good as oral PrEP offered by a vaginal gel, which is really amazing if the woman had a certain microbiome type. But in women that did not have lactobacillus, the efficacy of the drug was very modest. And we later found that this drug was being metabolized by these bacteria, as well as causing genital inflammation, which is decreasing the efficacy of this drug. And from this, it helped to change our thinking about HIV prevention and the importance of thinking about biological features in the female genital tract that are important for protection from infectious disease. Right now, this has led to many clinical trials that are looking at microbiome-based intervention for lowering incidence of STIs, for lowering HIV transmission risk in women, and those clinical trials are ongoing now in Africa, and there's a lot of funding in this effort. And we've expanded our research beyond HIV, as was mentioned before. We're also studying cervical cancer, and we're interested in how the host immune system interacts with the microbiome and affects disease susceptibility. And I can just skip that. And this is really built upon a lot of international partnerships that we have in South Africa and Uganda. We have collaborations in Spain and Thailand as well. And we also do local studies here in Cleveland looking at at-risk populations for HPV infection. Joining Case Western has been, Reserve University has been a fantastic honor. I've had the privilege of joining a group of really talented infectious disease specialists who are doing groundbreaking work in tackling a lot of different global health problems, including malaria elimination, neglected tropical diseases, maternal children, women's and reproductive health, microbial pathogens and antimicrobial resistance, HIV, TB, and other important global health problems. And it's really been an honor working with these really talented faculty. And this is built, again, along with a lot of international collaborations of these programs spanning not just here in the US, but also in Kenya, Madagascar, Papua New Guinea, in Uganda. And I would just like to end this talk by acknowledging all of the students. So we have an amazing brilliant students in the Center for Global Health and Diseases that are really pushing the discoveries in health research, some of which are shown here. And also a lot of the students in my lab that have helped us make these important discoveries and have really supported this work. And with that, I'd like to thank you all for coming. Thank you very much.
So now's the fun part. As you see, there's a chair sitting up here, so I get to invite Adam to come forward and take a seat. The university, certainly the school, values greatly endowed professorships and the continuity that they bring of excellence and accomplishment across our school, across our city. So without further ado, it's my great privilege to introduce Dr. Adam Bergner as the Adel Mahmoud Professor of Global Health and Vaccines.